Hello, everyone. My name is Maria Rea. I'm a student at San Francisco University High School, and I'm a member of the Marin County Youth Commission. Today, I am pleased to welcome Maria Rea to our video series with the Marin County Youth Commission. Maria is the Outreach and Engagement Coordinator with Marin County Health and Human Services, and I'm very happy for you to be here with us.
Thank you, Cameron, for having me.
Of course. So first, just tell me a little bit about yourself and your role at Marin County Health and Human Services.
Yeah, so like you just said, my name is Maria Rea. I am a licensed marriage and family therapist, and I currently work at the County of Marin as the Outreach and Engagement Coordinator. This position focuses on identifying underserved individuals in order to engage them and, when appropriate, their families in the mental health system so they receive the appropriate services. My role is to support BHRS, which is Behavioral Health and Recovery Services, efforts to reduce ethnic and racial disparities by increasing community engagement through social media and other outreach efforts. It is also to ensure that we're investing more resources, training, and support to community health advocates and promoters programs, and cultivating relationships with grassroots, faith-based, and other informal providers to improve clients' outcomes and strengthen our community engagement around behavioral health.
Nice. So how do you define mental health, Maria?
So mental health is our emotional, psychological, and social well-being. And it affects the way we think, we feel, and we act. And it also helps determine how we handle stress, relate to others, and make choices.
Okay. So obviously with the outbreak of COVID-19 and the isolation that almost all of us are going through, what are some of the challenges that you expect youth will face as a result of COVID-19?
Yeah, so during these challenging times of pandemic and quarantine, youth may struggle with adjusting to new routines, which may interfere with their sense of structure, predictability, and security. And this might bring confusion, frustration, boredom, fear, worry, sadness. And for youth that were already experiencing any kind of mental health diagnosis or symptoms like depression and anxiety, certain symptoms could increase during this time. Some youth may also worry about their own safety and the safety of their loved ones. And some youth might also worry about how are they going to have their basic need met, like how are their parents going to get food or pay rent. And of course, this is going to bring a lot of uncertainty for the future. And this is why we are collaborating right now with the social changery, San Mateo County, Alameda, and San Francisco, the CDC, and the Zuckerberg Foundation to create a youth-focused website to empower youth to stay ahead of the curve and to encourage them to stay connected and healthy during these challenging times.
That's amazing. And is that website already online, or is it still being developed?
It's still being developed, and it's going to go live at the end of the month.
Great. Well, we're looking forward to sharing that.
Yeah, of course. I'll let you know. I'll give you the link once we have it.
Perfect. Thank you. So what are some strategies to maintain positive mental health throughout this crisis, maybe specifically to youth and for the general public as well?
Yeah, so some strategies that we could all use right now, first of all, is to take breaks from watching, reading, and listening to the news. I know we all want to be informed about what's happening, but sometimes hearing about the pandemic constantly and repeatedly can be really upsetting. So to take a break from news in general, it's always a good idea. The second strategy is to take care of our bodies. I know because we're having to stay at home, a lot of us are spending our days sitting, looking at our computers or watching TV, but not really doing a lot of movement. And I want to encourage to find ways to try to stay healthy and to exercise some way. I know this is a really challenging time for most of us, and these are the times when we need to really get creative and find new activities. And this leads to my third strategy, which is to find time to relax and find activities that really bring joy to our lives. And this could be as simple as coloring, or we all have different ideas of things we like. I know, for example, for myself, I really like dancing, and it's not something I usually do a lot, but since all of this started at 5 p.m., once I'm done with work, I put away my computer and all my work-related stuff, and I'll just put music on, I'll start moving, you know. I would call it dancing, but sometimes it's not even dancing, it's like moving my body. And not only I'm exercising, but I'm also doing something that brings me joy. And it's really important to bring that kind of energy into our lives right now. The fourth strategy is to connect with others. I know most youth get support from help from their peers, and during this time it can be really challenging because of physical distancing. It can be really challenging to keep some social connections, but it's really important to maintain relationships and to reach out to people that we trust and that we can talk and talk about our feelings and concerns, and even reaching out to people that we know are having a hard time. This can be really valuable at this time, and I really encourage everyone to do it. Sometimes a text can go a long way. And the fifth strategy that I'm going to share with you all is create a flexible but consistent daily routine. And I know this is new for all of us, and I know before we had this shelter-in-place order, we had our routine, you know. So for youth, the ones that were going to school, you were waking up at a certain time, you had classes at a certain time, lunch at a certain time, and having a structure is really important. So I encourage people to really maintain some kind of structure. And that can be different day to day. You can create one at the beginning of the day or at the beginning of the week, and try to follow it as much as possible. And again, be flexible, because sometimes it's not as easy to stick to the routine. And we tend to be hard on ourselves when we're not, but it's important that we are flexible with that. So if I don't want to go on a bike ride like I had scheduled, it's okay for me to one day just sit and watch TV instead of doing the bike ride.
Definitely. So how is the pandemic affecting the work of the county, and maybe more specifically Health and Human Services as it relates to mental health?
So the pandemic is affecting the work that we do at the county greatly. In BHRS, our mobile crisis, the crisis stabilization unit, jail mental health, and access are still operating at full and expanded capacity. And other programs are maintaining lower staffing levels on sites, including medical professionals. And any support that can be provided to clients via telehealth is being done that way rather than in person. Additionally, all county workers are disaster service workers and are working in a variety of capacities outside of their normal roles and often on top of their roles. So for example, as some of you might know, the county created a COVID-19 call center where you can call and ask questions, any question related about COVID-19. And I'm working on that call center certain days a week, and on the other days I'm doing my normal work. And this is not a job I'm used to or I knew before. I'm learning as I go, but we all have that duty.
Great.
Yeah.
And then, so what are some specific resources or services that Health and Human Services offers for residents of Marin County who may be grappling with mental health issues? And especially during this time of COVID, how can young people and the general public as a whole access these services?
Yeah, so I have some hotlines that I think could be really useful during this time, and I'll give you the phone numbers, but I'm also hoping, Cameron, that we can write them down on the description of this video. And the first one, it's a local organization that we have, that's Buckelew, and they have a suicide and prevention hotline, and their phone number is 415-499-1100. There's also the California Youth and Crisis Line, which is for youth ages 12 to 24 and their families. And their phone number is 1-800-843-5200. And there's some support for LGBTQ youth and through the Trevor Project, and their phone number is 1-866-488-7386. And for those of you that don't feel comfortable calling, or because you're in an uncomfortable situation, you could also text MHAA to 741741, and you'll be connected with a crisis specialist, and you could text instead of talk. And lastly, for people that want some kind of mental health or substance use assessment, you can call our Behavioral Health and Recovery Services Access Line to 1-888-818-1115.
Great.
Mm-hmm.
And then I guess a follow-up question would be, so as community, as a community or outreach and engagement coordinator, how does Health and Human Services interact with community service providers, nonprofit organizations? What's the extent of that interaction between government and nonprofits?
Yeah, we're trying to really work together during these challenging times. Sometimes I know we all feel like there's some resources over here, other resources over here, and we're trying to connect all of those resources. And that's why we're collaborating on this page that I mentioned before. We're constantly, every week, we check in with our nonprofit organizations and with our community partners to know what services they're providing, so we can let our community know what's available.
That's great.
Yeah.
Alrighty. Is there any last piece of advice that, or anything else you want to share with the audience or young people in general regarding mental health?
There's a lot of resources on the internet. If you're feeling lonely, reach out. This is a really challenging time for all of us, and we're all learning as we go. So like I said, I encourage you to get creative, to find ways to connect to other people. Even if it's a person you haven't talked with a lot in the past, reach out. I'm sure people can really use that connection right now.
Great. Thank you so much, Maria, for joining us. We really appreciate your time.
Yeah, thank you, Cameron, and let me know if you need anything else.
Thanks.